If you haven't gotten a flu shot yet, please listen as Dr. Lan Tran-Phu answers questions about this contagious infection and what steps you can take to avoid getting sick. Dr. Tran-Phu is the medical director at the Cumberland County Department of Public Health, which offers flu shots through its immunization clinic.
The flu is a respiratory illness caused by an infection with the influenza virus. So we can catch the influenza virus by the respiratory droplets, and we become sick after we catch the flu. The flu, being an infection, can cause several symptoms. And when we are sick with the flu, of course, we don't feel good. We feel achy. We have fever. We cough. We don't feel good to go to work. That's one part. The other part is that because the flu is a very contagious disease, if we go to work, we can spread it at the workplace, and our coworkers will catch the flu also. Then on top of that, when we live at home, we can spread the flu with our family members. So the spouses and the children get sick. If we are in contact with the grandparents, they get sick also. So it's spread by spreading in the workplace. So that will cause increased absenteeism. And then the children miss school, so we have to stay home with the children also, and that will even further the absenteeism from the workplace. Anyone can get the flu because it's spread by respiratory droplets. We can catch it anywhere we go. So we can go to the grocery store, we can go to church, we can go to school, we can go to work, we can catch it. Anybody can catch it, from children even younger than 6 months of age all the way to the elderly. So all age, anywhere. The people who are at the highest risk to develop complications from catching the flu are, number one, the people who have deficient immune system. In other words, the people who have like underlying chronic disease like diabetes, heart disease, chronic lung disease, chronic kidney disease, and then, like for instance, people who have to deal with cancer, they are, because of their decreased immune system, they don't fight against the influenza virus very well, so their symptoms are much more pronounced than the people who have a very strong immune system. And then if you are a caregiver to the people who have all of those illnesses, then you can spread those on to the people who are not as strong as you are. We should get the flu shot every year to not only protect ourselves, but also protect everyone around us. So you might be in contact with a very young newborn. They cannot get the flu shot until they are 6 months of age, so they can get very sick. You can get in contact with a pregnant woman, and you can give the pregnant woman the flu. And then you can get in contact with older people with immune deficiencies, so you can give them also. So all of us should get the flu shot every year to protect everyone around us. And then of course, if you are in high risk, like I said earlier, then you should get the flu shot to protect you. The flu shot, well, it depends on each one of us. Maybe for ourselves, we have a very good and strong immune system, so we might not be very sick with the flu, but we should think about the people that we might be in contact with. Not everybody can have the very strong immune system that you have. So when we think of ourselves and we said that, okay, last time we had the flu, we were not that sick, which can be true again this year for you, but please think about the other people that you can be in contact with. Let's say that the new babies that were born in your family, the elderly that live in your neighborhood or that go to the same church as you, or the people who are struggling with cancer or chronic illnesses that you don't even know with, but you might be in contact through work. Then you get the flu shot. By when you protect yourself, you protect everyone around you. And healthcare workers, of course, we all need to get our flu shots. The flu shot, well, you should get the flu shot anytime, but usually by the fall, like right now, September, October, November, we like the grocery store, the pharmacies, the health department, we already begin to offer the season flu shot, the new season flu shot. The sooner we get it, the better prepared we are, because we prepare our immune system to deal with the flu virus if we should get in contact with the flu virus. The flu shot will not give you the flu illness. When you get the flu shot, you might have some side effects, like for instance, if you get it like a shot, some soreness in the injection area. You might feel a little bit achy, but that's the extent of it. You do not get the whole flu illness with the flu shot. If you get the flu vaccine by nasal spray, you might experience some nasal congestion and runny nose, but you don't get the flu with the flu vaccine. To help prevent the spread of the flu, there are two main important actions that you need to do. First, like we just mentioned, we should get the flu vaccine every year. And then also we must wash hands. Even though the flu virus is through respiratory droplets, sometimes like when we sneeze, it gets on our hands, and those droplets can we can infect others, or we can infect ourselves if we catch it on our hands. So always wash our hands, and then also protect your cough. Like for instance, in the past we cough or we sneeze and we use our hands in front of our face, but now the new technique is to use your elbow so that you can keep your hands clean and less spreading to other people by the use of your hands. You can get them at the health department, and you can get them also at the different pharmacies. And some grocery stores, they organize that. And also when it's like during the fall, watch on the media, they organize special clinics, special flu clinics. So keep watching the news. They will let you know when and where to have the special clinics. But like for instance, at the health department, we have it. We are open every day from Monday to Friday, and we serve the public from 8 to 5 every day. So you can come to the health department anytime. To get more information about the flu shot, I would advise to get on the cdc.gov website. That's where you have all details about the flu shot, who should get it, what are the symptoms, how to protect yourselves, and if you have special medical conditions, what you need to do. Also, you can come to our own Cumberland County website. You can get the information, and especially where to get the flu shot and the special clinics for you to get the flu shot for your convenience.